Hello, welcome back. We are cruising into our final interview today in the Arthritis booth here at the Canadian Rheumatology Association and Allied Health Professions Association annual meeting. We are really happy. I'm not going to try to pronounce her last name. I'm going to make her do it because I don't want to really mess it up. But we're so thrilled to be here with Inez, who is from Toronto SickKids Hospital. Yep. She's a clinical dietitian, and Toronto SickKids should give you the clue. She works specifically in the area of nutrition in children with arthritis. And this is such an important topic because every parent I know who has a child with arthritis wants to know, am I doing the right things for my child in terms of their nutrition? So we're really thrilled to have you here. Why don't you pronounce your last name for the audience?
Thanks, Cheryl.
Yeah.
So for those of you who are participating or who will at a later time, my name is Inez, and my last name is Martincevic. It's a very ethnic name, but if you want to know how else I may pronounce it, it's Martincevic. And I'm really excited to be here.
Oh, so that's fantastic.
Thanks for inviting me.
Well, welcome.
Thanks.
Listen, we're going to dive right in.
Yes.
So I have to tell you that as a patient organization, what we hear and what we receive through our mail and our inbox and our social media, so many questions about diet and nutrition. Let's start where you're obviously expert in practice, and that's in children.
Yes.
So we're talking about children who have very significant autoimmune disease, some worse than others, which I imagine impacts nutrition. Tell us how, first off, Inez, how does the disease process in children actually affect the nutrients, the things that they're actually putting into their body? What does it do? Is it harder for them to get benefit from their nutrition? Easier, different? Can you?
Sure, that's a good question.
I think maybe it's a starting point because parents want to know what is it about the disease that affects my child's nutrition.
Sure.
Yeah.
I think so. To start off, it being an autoimmune condition, we do know that will have effects on things like appetite and physical activity,
right,
mobility, quality of life. There's those psychosocial aspects that are important, and we all know that eating is just as much nutrition and life-sustaining as much as it is social, right? And so there's two aspects to that question. So from a medical perspective, from sort of your physiological perspective, there isn't any concern that a patient with arthritis, whether they are a pediatric patient or adult, as we would say, that if they don't have another underlying gastrointestinal or gut condition, that they wouldn't be able to absorb those nutrients well. So that isn't the concern. But there's always questions then about nutrient utilization. So once it's in your body, what's happening? And so that's where it can become more complex. So active immune diseases like arthritis, what they can do is they can make people quite frail. They can affect your physical mobility, your muscular strength, your ability to move and get around and about. But also the active disease itself will impact how your body is taking those nutrients that are absorbed and what it's doing in its different roles. So there certainly is that aspect to the nutrition that's important, and that's where monitoring for malnutrition is extremely valuable.
And so how do they go? How do parents go about doing that?
So
or how do you as a clinical
Sure.
dietitian, how do you deal with that with parents?
Right. So it would depend on how that malnutrition is defined. So I always let people know that malnutrition isn't just that child or patient that's completely wasted. Malnutrition is also people who are overweight and obese. So there is that spectrum to that term.
So they're not getting the right kind of nutrition.
That's right. So malnutrition means that you aren't getting adequate nutrients. And nutrients come in two general classifications. Macronutrients, that's your carbohydrates, your fats, your proteins. And then your micronutrients, those are all your vitamins, your minerals, and all the other beneficial things that you get from foods, things like antioxidants and whatnot. And so malnutrition, in general, simple terms, means that you're not getting enough of both your macro and micronutrients.
I see.
So you can be malnourished, meaning that you're very wasted. Maybe you, from an arthritis perspective, are unable to prepare your own food, or you have joint involvement that makes it difficult for you to eat, like TMJ. So for those of you who are listening, that's your jaw joint is affected, and so you can't chew as well. You might be elderly and not have the proper dentition to eat well. Maybe you need dentures, you don't have them, or you have them, they don't fit. You could be a child, you're not feeling well, so now you're just a little bit more picky.
Right.
You know, all of these aspects that impact your nutrition, but then also the overnutrition is the other category that people forget about. You know, most people don't think that overweight and obesity is malnutrition, but it is.
Yeah.
It means you're getting in too much energy, and you might not be getting enough of those micronutrients.
I see. That's absolutely fascinating.
Yeah.
Like, and the part about inability to prepare food and chew food, when I was first diagnosed, I actually couldn't prepare my own meals, and I can tell you I got very, very thin.
Yes.
And only when my disease began to be better controlled was I able to then, kind of turn that around. If I'm a parent, I'm sitting in front of you, and I've got, my little Julie sitting next to me and recently diagnosed, I'm looking for advice from you. How do I keep her healthy and happy as best I can nutritionally? What's sort of the package deal you say to parents, especially with newly diagnosed children?
Yeah, that's a good question. I mean, and to be fair, in an ideal world, I would really like the opportunity to sit down with every family that's newly diagnosed. Yeah. And unfortunately, our resources are so limited that does not happen. Yeah. When I do get to meet with a family, though, and I do get asked that question, how can I keep my Julie well? Yeah. I think what it does come down to ultimately is a balance from the perspective of you still want to enjoy food, and you don't want to feel like you're missing out on food, but you really need to know what good food is. Yeah. And I think that's where the knowledge gap is. And I think that sometimes when people can get trapped into thinking that if they're eating certain things or a certain way, I'm avoiding the word diet. I don't like to use the word diet in practice.
I don't either.
I feel diet has a negative kind of sort of vibe with it. And once people start feeling like they're dieting, they feel a little bit trapped and limited. And I don't want people to have a negative association with food, because food is meant to be enjoyed. I think what a lot of people don't get the opportunity to learn about is what is good food and how can we nourish ourselves well, and what that means when you do have a chronic inflammatory disease like arthritis. Yeah. And so what can you do to complement all of the other interventions that you're doing to stay well. Yeah. And so from that perspective, what I tell my patients is you really, really, really got to eat more vegetables. I always get smiles when I say that.
You sound like my mom. That's so funny.
But that is so vitally important from an energy perspective, from a micronutrient perspective, also just overall from that health perspective. Yeah. There's so much research coming out on the role of, quote, diets for therapy, and all of the diets that are out there that they're looking at for RA, so that's rheumatoid arthritis, for OA, which is your osteoarthritis, these types of conditions, is that you ultimately, you want to nourish yourself well. You don't want to overnourish yourself. You want to nourish yourself with real food. You want to avoid your processed foods, your packaged foods, your foods that are full
just
of
common
filler.
Sense. It's kind of common sense.
It is a bit of basics. Yeah. And the evidence, the research, because there's an interest in this. So, if there's one thing that I can say the rheumatology community has done is they've taken the feedback and they've really heard people. And the first question people always say is, oh, well, can I eat better? Or what can I do to change what I'm eating?
Because those are the things we control. And that control piece is really important to people like us.
Couldn't
because
agree more.
whether you're a child or you're an adult, when you get diagnosed, so many of us lose complete control, or we perceive that we lose complete control.
Sure.
Because physically, we were previously, before our diagnosis, in command of our body, and now we're not. Even when we sometimes take all of the medicine and eat well, sometimes the disease still doesn't give us the control back. So control, I'm glad you raised that word. So it's a big deal. And I think the more things in your life you feel you can control, such as your nutrition, the more power you feel.
Absolutely. It's not only empowering, you learn about yourself too, but you also feel that even though, despite your awareness of maybe knowing that you can't really control it, you feel like you can contribute to somehow being involved in that evolution of the disease, which I think is so vitally important, especially when you haven't felt so well. And diet, we choose what we buy, and we actually choose what goes in our mouth and what we swallow. And so, going back to those basic principles, yes, ultimately eating more vegetables, but not just eating vegetables and boiling broccoli. That's gross.
I'm so glad you said that.
Oh, it's awful. It's about knowing how can you make it taste better. And tasting better doesn't imply that you've got to fill it and coat it in the dressing. It's about knowing how to make it crisp and crunchy, fresh or pickled, some lemon, some seasoning, some herbs. It's all about that kind of stuff. And so even trying to engage people in, loving food too, and having a healthy relationship with food, I think is important. And where it becomes really important, and where forums like this I think are great, is having people within the community advocate back, particularly to our stakeholders, our government, to say, I would like better access. I would like affordable access. And how can you help me make that happen too?
I think, we kind of lose sight sometimes that advocacy about food and all of the things you just mentioned is actually really important, and that not everyone enjoys a socioeconomic status to be able to buy quality food staples.
It's expensive to eat well.
It really is.
And
it really is.
Sometimes there just isn't that wiggle room in your budget. And so then it's about learning to be creative with what's available, that's affordable, but that's also limiting, and I feel like that's not fair. It's easy for me to say eat more vegetables, but it's also not affordable for everybody.
Yeah, I agree. Talking about affordability reminds me to ask you the question about organic versus not.
Sure, yeah.
Is it I don't know. Some people say it makes a big difference in the flavor. We know it makes a big difference in the cost, actually.
Yes.
So for our viewers, maybe either assure them or not that non-organic's okay, or how do you answer the question?
Yeah, no, and it's a valid question. It's a question I get asked quite often. So I answer it in stages.
Okay.
So if we're talking about just the nutrient content per gram of serving of food, if you compare your organic versus your non-organic, the amount of, let's say, vitamin C, or the amount of sucrose that's available, your actual nutrients are no different. And they've done studies looking at that difference. Okay. So I do reassure all of my patients that the nutrients per content of an organic apple, let's say, versus a non-organic apple are not significantly different. They're basically the same. Okay. Where it becomes different now, of course, is the environmental exposures and how it's grown, and whether or not that has an effect on how you're feeling is a subjective perception. So if you tell me that you feel better when you eat organic chicken, let's say, then I might say to you, okay, then you would want to invest in organic chicken. However, making your entire grocery list organic is unaffordable for most people.
Yeah, it is actually.
So then what I tell my families is, well, then you want to be knowledgeable about what it is that makes it organic. So organic means how it's grown and what it's exposed to. So there's no herbicides, there's no pesticides, okay? Unfortunately, though, speaking about control, we don't control our wind currents and we don't control our environment. So even though that piece of food might be labeled organic, which, by the way, in Canada is not a regulated title per se.
Oh.
There are terms around whether or not a food manufacturer can put organic on a label or not, for sure, and there's certain regulations that the CFIA, that's the Canadian Food and Inspection Agency, does regulate. But it's not a universally defined term, meaning in Europe it's different than in Canada, is different than in Australia.
Oh.
Okay? And we do get a lot of our produce and stuff from America, number one. And then number two, there's still a lot of discussion about what truly makes something organic. So for example, we have lots of apple orchards in Ontario, right? And so you have one apple farm that's maybe 50 kilometers away from an organic farm. How do I know that there hasn't been any either pollination that hasn't happened? So the wind that picks up the seeds that now grow on one orchard to another, or what other herbicides, pesticides, chemicals have now shifted in those wind patterns, you know. So I can't with huge confidence tell my patients that that organic apple
is truly
organic. Okay, so that's one problem with the issue of organic versus not.
Yeah.
And then the other one is okay, ultimately there might be some things that you can do that you can minimize these exposures with.
Okay.
And that's what I tell my families. That should probably be your goal. That's a realistic goal.
Okay.
So for example, a banana, you take the peel off a banana, so maybe you don't need to buy the organic banana. However, your grapes that you're buying, that you're eating the whole thing.
Because you're eating the skin and everything, then
you might want to buy that one organic. And I will say there is a taste difference. There truly is a taste difference.
I think there is.
And so if you value food, maybe there is a little bit of a sacrifice you have to make in your decision around, okay, well, maybe I won't buy the Chips Ahoy cookies. Junk food. I'll put the extra money into the organic grapes.
Yeah.
So there's a list, they call it the Clean 15. Okay, so if you Google Clean 15, it gives you the list of what is considered to be the organic produce and or foods that you actually do want to invest in versus your whole grocery list. So I do recommend that to families.
You heard it here from Inez, the Clean 15. I'd never heard about the Clean 15.
Yeah, so if you Google it, and then it'll give you the more common list of what other sort of reputable websites might advise as well. Yeah.
I'm glad you took us there because we're going to kind of round up our conversation with reputable resources.
Right.
Where do you direct your families, your patients? Where would you direct the public in general who's interested in their health and their nutrition? Where do you send them?
So for arthritis, especially the Canadian Arthritis Association, for sure. I've had the opportunity to work with them and do workshops and facilitate things, and they really are not just a voice for the patient. They also work with practitioners and researchers around making sure that the information that they're sharing is really truly up to date. And so I do strongly advise that families connect with them, check their website. They have really good nutrition information.
Great.
And I am actually proud to say that they're one of the associations that is really truly up to date. I mean, when it comes to new and exciting research stuff, they're on top of it.
Right.
And their recommendations are really, truly reputable. As it relates to Canada, I live in Ontario. We used to have a really good resource called Eat Right Ontario, but that no longer exists. So I wanted to let people know that unfortunately with cuts, which are happening across the board, there's some limited resources around what to find out for good nutrition.
Are there any helplines? Wasn't there?
This was a helpline in Ontario.
Yeah, that's unfortunate.
Yeah, it's
I
really
think we
too
have
bad.
dial a dietitian in British Columbia.
Yeah, so we used to have that in Ontario, and that's gone too.
But so the internet and internet-based resources are really important. What about apps? Do you know of any good apps?
I don't, unfortunately, not for arthritis in particular, or autoimmune diseases actually. But I do encourage my families to connect with their primary health care provider. If there are no local resources that their primary health care specialist can tell them about, then that, for me, I see that as a gap, and I see that as an opportunity for all of us to work together so that people like me who do get to work in a specialty area can actually share my knowledge. So what I get to do at events like this is I get to schmooze and I get to chat and I get to meet,
Well, you're very good at it, Inez. You're very good at it.
But I get to share that knowledge and share that information that people don't get access to, because that's what we do want for our patients. We want them to know what's reputable and what's beneficial. I always get disheartened when I hear families spending a lot of money on a supplement that actually
is not going to make a difference.
To have any benefit, and especially more so if you don't feel a benefit, but you think that there is a benefit, and so you're still putting energy and finances into it. It is disheartening. So I think we need to do a better job about talking about this and making sure that we all share our knowledge across Canada and what we can do to help each other, for sure.
Well, I can tell you we're going to be talking to this lady again because we would love for you to share some of that information with our membership. I think this whole idea about spending out of pocket for things that aren't evidence-based, we really believe in the evidence-based. We certainly don't, discourage people from doing things, but with limited resources, sometimes these choices become actually quite critical for our overall wellness.
For sure.
Yeah. So thank you so much. I'm just going to turn to Anita and see if we have any questions.
There is a question about how you got into the field of nutrition.
That's actually an interesting story. I was doing my undergraduate degree at the University of Toronto in health sciences, particularly in cell physiology. And I realized when I was doing research that I didn't like working with pipettes and plastic, little
things.
Dishes, with, bacteria. And I really like people. And of course, I think when people get touched by someone close to them being affected by illness, it kind of sort of got me thinking that I could take the knowledge that I'm learning and not only translate it into research, but then bring it to people like I did with my own family. It got me into the field of being a clinician, and then I got into nutrition doing my master's. So that's how I got into my role.
Amazing. And we're so darn happy you threw away those pipettes and those plastic dishes and started dealing with real people, and particularly children with arthritis.
Yeah, they're great. I learn a lot from kids.
They're like, let's just follow the kids.
Yeah.
Let's just follow the kids.
They're great.
Yeah.
And following up on your comment about organics and there's a question about pre-packaged vegetables or frozen vegetables. Are the nutrient contents the same in these pre-packaged or frozen vegetables?
It's a great question, especially around affordability. So let's first talk about frozen. So most frozen fruits and vegetables are actually frozen at the time of picking. So they are absolutely just as nutritious, and they're really affordable alternatives, particularly in Canada where we live with seasons. So, I wish I had a big, beautiful home, in Mallorca, Spain, where I could just, have everything
pluck
fresh
oranges
from,
off of
my own, trees and fresh out of the sea. I don't. So I use a lot of frozen fruits and vegetables in the fall and winter time when things are out of season. And so you can trust that for sure. When it comes to other prepackaged fruits and vegetables, I'm going to assume this means things that are like canned. Okay, so canned has been preserved. So what I tell families is, from a nutrient content perspective, they're not significantly different. However, because they've been preserved, you want to do things like rinse them really well. You want to wash them really, really well. You want to get rid of that excess sodium. We don't need extra sodium at all, none of us. We get a lot of sodium naturally from food, so you really want to rinse it well if it's canned. And then what you want to do is you want to do something to add back a little bit of texture, right? Because they usually come out a bit soggy, they're like wet and soggy. So from a taste perspective and from a texture perspective, you might want to do something else like bake it to crisp it up, dry it out a little bit, roast it, barbecue it, these kinds of things. But you certainly want to rinse those. And then if something is packaged and it's dry, I'm thinking lentils and beans, these kinds of things, then you definitely want to soak them. You want to rehydrate them, and then you want to use them.
Yeah.
But they're all good alternatives, particularly, as I said, in non-seasonal times for people to access food. And they often are much more affordable than the fresh alternative.
Interesting.
Yeah.
And we're going to end with a fun question.
Yeah.
Can you give us the Coast notes about common vegetables and their benefits for someone living with arthritis?
Oh, nice.
Oh, wow. Okay.
Cole's notes.
Whew.
Ready, set,
I was going to say,
go.
that's pressure. Okay, so I want to make sure that I answer the question well. So, vegetables, I'll start off by saying we want to think color, okay? So we want green, we want orange, we want yellow, we want red, we even want purple, okay? And what we want to do is we want to incorporate them pretty much with every meal or snack in one way or another. Fruit we also want to incorporate, but bear in mind that they're naturally rich in sugars. And I'm not saying that these sugars are bad. I'm not. I'm just saying you got to watch calories.
Yeah.
It's really easy to eat a pint of strawberries. I've been there, And even though those calories aren't the same as a cookie, it's still calories versus vegetables, which are the most nutritionally dense option. So they've got a lot of those vitamins and minerals and antioxidants and things that you want, but they're very low in calories because they're high in fiber, they're high in water. So you always want colors, and you want to incorporate them with pretty much every snack or meal that you're having. And so what you want to do is you want to vary it up too, right? So, iceberg lettuce is crunchy and all, but it gets a bit boring,
Yeah.
And so what you want to do is
And
you
it's
want to
not
build.
a bright color. Does that matter?
No,
Okay.
not so much about the brightness, but what you want to do is you want to mix it. So, for example, what I would do is I love iceberg lettuce for crunch, but then what I do is I also slice some radishes,
Yeah.
and then I take cucumber, right? And then I might do a little bit of red pepper. Green peppers make me burp. It just gives me reflux. It's, so I don't eat those. And then that's when you start mixing. So you get your yellow pepper, your red peppers, you get your greens from your salads. These are the things that you want to do. And then I also might do something like take asparagus, which, is a bit funky in the bathroom, but that's okay. It's still really good for you. And you just do like a quick little pan fry or an oven roast, and you incorporate that. So you got something a little savory, a little warm, a little bit of fresh, I do something that a lot of people don't do, but it's really affordable and it's really healthy. I make my own dressings. Okay, so use, your olive oil, use a really good vinegar, mix things yourself. There's really, really good recipes online, allrecipes.com. Be curious, there's so many of these. Make your own dressings, lightly dress it. Use lemon. Oh, lemon's great. Just put lemon on everything. You'd be like Greek, You put lemon, you give freshness. And that's what you want to do. You want to keep building these kinds of things. There's so many vegetables out there. I get so excited when I think about it, right? Then there's so many things that you can do. Like cauliflower is really gross when you boil it. You just plop it on your plate. It's wet. It's gross. But, just chop it up raw and do a quick pan fry, and you've got a great alternative to rice. These kinds of things.
Yeah.
So I tell kids, for example, mix a little bit of rice with a little bit of this cauliflower, and then you're already eating more vegetables and reducing your starch.
It's like hiding the peas under the mashed potatoes. That's
a little
what I
bit,
used
right?
to do.
You just kind of you got to be creative with it a little.
Well,
so have fun with it, guys.
That is amazing. So there's the Coles notes for you, delivered in the most vivacious, informative way ever. And I'm sorry, now we have to go because I'm taking Inez home with me, and she's going to make me dinner because everything she said, I'm like salivating
right?
over.
Yep.
So we want to thank you so much for coming in.
It was
what
great.
a great, energetic way to end our day.
Oh, not at all.
Such a
Thanks for inviting me.
fantastic information for our viewers. We really appreciate it, and we will definitely have you back.
I'm looking forward to it.
Thank you so much.
Thanks, Cheryl.
Yeah.